Millions of electrical nerve impulses fire simultaneously. This sheer velocity requires a complex logistical network to ensure every signal reaches its exact destination. This diagram illustrates how the planet Mercury governs that internal logistics network. Through its rulership of the sign Gemini, Mercury controls the physical tubing of the body, including the respiratory channels, the ureters, and the central nervous system. Mercury also claims secondary rulership over the metabolic splitting up processes of digestion. Through the sign of Virgo, it directs the exact breakdown and sorting of nutrients within the pancreas and the small intestine. Every logistical operation in the body requires fuel. For Mercury to successfully direct nerve impulses and split up enzymes, the body requires an uninterrupted supply of thiamine or vitamin B1. Looking at this Ayurvedic matrix, we see the direct codified relationship. The symbol for Mercury sits exactly parallel to vitamin B1 and the nervous system, establishing the exact biochemical dependency. This means any astrological disruption to Mercury is a direct mechanical threat. It directly compromises the body's internal logistics and neurological wiring by severing its fuel supply. Astrologers measure these disruptions using hard aspects. A hard aspect is a stressful angular relationship between planetary bodies within a natal chart, creating measurable mechanical tension. A layman might look at an afflicted Mercury and diagnose a vague sense of nervousness. A clinical astrologer looks at that exact same geometry and diagnoses a specific, measurable nutrient depletion. The exact nature of the disease is determined by the specific intersecting planet. In the perturbation matrix, the primary culprits attacking Mercury are Venus, Mars, and Jupiter. Each of these three planets introduces a distinct variable that corrupts Mercury's baseline. They dictate whether the patient will suffer from a loss of venous elasticity, acute inflammation, or severe assimilation blocks. By analyzing these angles, the practitioner moves beyond abstract celestial observation and executes highly targeted biochemical interventions. Mercury and Venus operate under a strict orbital constraint. Because of their proximity to the Sun, they can never separate by more than 76 degrees. Because of this 76-degree cap, major negative aspects like squares and oppositions between these two planets are mathematically impossible. This medical text explains the workaround. To diagnose a Venus-Mercury affliction, practitioners rely on minor hard aspects, specifically the semi-sextile and semi-square. This minor angle creates a dangerous biochemical consequence, an imbalance between Mercury's thiamine and Venus-ruled niacin. Venus holds dual rulership over Taurus and Libra. Because Taurus governs the throat, this niacin imbalance physically manifests as a malfunctioning thyroid gland. Their orbital proximity requires extreme precision. Subtle angular tensions between Mercury and Venus dictate profound metabolic and thyroid failures, conditions linked to excessive carbohydrate consumption. A minor aspect between Mercury and Venus often acts as a dormant vulnerability. It requires the strike of an outer planet to activate the pathology. When Saturn applies a hard aspect to this configuration, the Gemini-ruled tubes of the body physically stiffen and lose their elasticity. This loss of elasticity is driven by a simultaneous drop in Venus-ruled copper and Saturn-ruled vitamin C. If Pluto enters from Aquarius, the consequences migrate to the nervous system. This specific intersection triggers the severe degeneration of the nerve's protective myelin sheaths. If Virgo intersects, the target shifts to the intestines. An extreme lack of vitamin E destroys intestinal tissue, leading to diseases like sprue or celiac. Outer planets act as an escalation mechanism. They turn a manageable niacin and thiamine imbalance into permanent structural and neurological decay. Contrast that slow decay with the sudden onset of systemic nerve inflammation. This is the reality of a neural pathway sparking and failing under load. A hard aspect between Mercury and Mars signifies acute inflammation and immediate neurological disruption. Mars governs phosphorus. A Mars-induced phosphorus deficiency causes nerve transmission to falter, manifesting as unexplained chronic tenseness. Mars also rules vitamin B12. When this geometry depletes B12 stores, the central nervous system suffers severe impairment, eventually leading to slurred speech and paralysis. Because Mars governs bodily sodium, an imbalance heavily impacts the brain's electrical grid, introducing a direct risk of epilepsy. Mars does not weaken the system slowly over time. It actively attacks Mercury's logistical pathways, burning out the body's electrical hardware through acute mineral depletion. To manage this attack, the practitioner must calculate the thiamine burn rate. Mars dictates the exact speed at which the body exhausts its Mercury-ruled fuels. The elemental sign determines this rate. If Mars sits in a fire or air sign, the body rapidly incinerates thiamine. This patient requires massive supplementation. If Mars sits in a water or earth sign, like Cancer, thiamine supplements must be heavily restricted. Excess thiamine triggers an overproduction of stomach acid. Shifting to Mercury's Virgo rulership reveals the digestive fallout of a Mars affliction, the absolute destruction of healthy intestinal flora. Two specific Mars-ruled elements are responsible for this gut destruction: massive disruptions in folic acid and the depletion of natural bodily chlorine. The elemental placement of Mars is critical. Prescribing the right vitamin for the wrong astrological element triggers a secondary digestive crisis. The Mercury-Jupiter dynamic operates on a completely different mechanism. Rather than destroying tissue, it creates a physical assimilation block. Jupiter rules vitamin B6. Without adequate B6 present at the receptor site, the body's uptake mechanism fails, leaving it physically incapable of absorbing thiamine. If Saturn is involved in this Jupiter block, the deficiency expands. The body also loses its supply of manganese. Because Jupiter rules Sagittarius, the sign governing the thighs, this specific metabolic failure frequently triggers severe inflammation of the sciatica nerve. Jupiter afflictions are highly deceptive. Patients can consume massive amounts of thiamine, but until the block is corrected, they remain starved at a cellular level. A hard aspect identifies the vulnerability, but the intersecting planet dictates the weapon used. The Venus signature indicates lost tissue elasticity and niacin imbalance. The Mars signature reveals acute nerve inflammation and phosphorus depletion. The Jupiter signature points to an assimilation block, missing B6. This is the exact moment where abstract celestial geometry clicks directly into the rigid, microscopic structural lattice of human DNA. By decoding the geometry of planetary afflictions, the practitioner maps the exact structural and biochemical reality of the patient,